I mean, obviously, the COVID situation is exacerbating the problem, but it's been around for years. What are the key points here? What is making it so bad?
Yeah, so the NHS since 2010 has been relatively defunded. If you compare that to historical averages on rises in NHS funding, the waiting list has been creeping up over the past decade. It got to the point of about 5 million people on the waiting list. It's certainly shot up with the pandemic. So there are many factors that are contributing to the waiting list. On top of that, you have staff vacancies, which have been exacerbated by the assault on salaries. There's been real terms shrinkage in the wages of doctors and nurses, anything up to 15 to 20%. So the NHS is not retaining staff. We had Brexit, which led to a bit of an exodus of European staff within the NHS. And we've also had a massive reduction in NHS bed capacity. So since the 1980s, we've lost 50% of NHS beds. In the last decade, around 18,000 beds have been lost. So without the staff, without the funding, and without the bed capacity, it's rational that the waiting lists are going to rise. And unfortunately, a lot of this is down to deliberate government policy.
Well, people who are forced to wait, many people are in pain and are also very, very worried that just waiting will make their condition worse. On the other hand, some are choosing to go private. If you do choose to go private, are you contributing to the crisis or are you ameliorating it?
Well, you know, it's regrettable people have to go private. How they're going private, often they're having to pay out of pocket. I've had patients of mine who've been on a waiting list for a long time, let's say with needing a hip replacement. They're having to dip into life savings to go private. Now, the NHS, you shouldn't be paying twice through taxation and then through your pocket to get a routine operation. So it's not acceptable. People are desperate and being pushed into the private sector. The NHS, as a universal public service, should be having excellence for everybody. Nobody should be waiting this long. So it may take somebody off the waiting list, but it's not the right way for that patient to go.
I hate to put you
forced into it.
Yeah, but I hate to put you on the spot, but do you do private work?
I don't at all.
Because a lot of your colleagues do.
Yeah, well, I'm not defending that, but as a principal, I've not done any private work. All my work is within the NHS. So, you know, I can't come here and claim to be a big supporter of the NHS, yet doing private. But I entirely understand why people are opting to go privately, because the stress is far less, the income is probably greater, and you're getting people who haven't been waiting that long, maybe not that complex. So it's a bit of a pressure valve, I'm afraid. So if you destabilise the NHS, more doctors and nurses are going to drift into.
Do you think it is literally doing that? If you go private, or if you're a doctor who chooses to go take on private work, are you destabilising the NHS?
Well, that capacity, that work capacity you might be contributing to the NHS is lost to the NHS. So, you know, I'm not criticising people who go that way, but the system has been brought to a crisis point where that becomes a rational decision for a lot of people.
Does there need to be a rethink of NHS? I mean, do you think a rethink of the NHS? The problem is it's so huge. But I mean, it's looking at financing, it's looking at structure, it's looking at the needs which are addressed by the NHS. Does all that need some sort of reform? Politically, people don't want to do it, but is that what we need?
I've been in the NHS for 30 years. There's never been a time when there hasn't been reform. The problem is the reform, the direction of travel, is to replicate the American system. There's been consecutive legislation, all taking a stepwise in that direction, and there's a bill before Parliament at the moment, the Health and Care Bill, which will transform the NHS into something resembling the American managed care model, which is run by private insurers, and the objective is profit, and they'll be allowed to deny care to generate surpluses for shareholders. That's the system we're copying, and that's totally the wrong direction to be going in.
Can I just ask you about COVID? Because we're hearing that another vaccine has been approved, Valneva. I've never heard of it, I've got to be honest. Is it important that more vaccines are being developed? Is that an important step?
Yeah, I think vaccine development is important, but what's even more important, we need the evidence to show the effectiveness of the vaccine. That needs to be publicly available. We shouldn't be having policies which are based more on ideology rather than good evidence. So in terms of mandating the vaccine for people who are low risk, I do not support that, but I do support recommending vaccines for people who are high risk. And again, not forcing people into this, because we have to respect individual choice and we need to use persuasion rather than force to get people to do
Can I just ask you, I mean, obviously there's one thing about low risk and one thing about high risk. What about those in the middle? Should they be getting vaccinated or not?
Yeah, well, they need to talk to their GP or their consultant and weigh up the risks.
Would you recommend it as a doctor?
It has to be done on an individual level. So it depends on the particular risks. What is the potential harm if they get the virus? Have they already been exposed to the virus? Have they built up natural immunity? What does the vaccine add to their protection?